And yeah, besides that, and fruit, of course.
So I was going to ask you that
Mm.
regarding fruit and fruit juices for diabetic.
Fruit is allowed, but in small quantities. Fruit juices are allowed, but remember, each glass of fruit juice has got 3 fruit squeezed into that glass. So it has fructose, which is a natural sugar, and in small quantities, it may not affect your blood sugar, but in large quantities, it certainly increases the sugar. So we try to avoid fruit juices.
So at the start of the show, I mentioned the study that was published in one of these journals
Mm-hmm.
regarding a University of Guelph
Mm-hmm.
research study regarding avocados
Yes.
and the fat molecule in them, which is shown in laboratory tests to really help, especially those who are either insulin resistant or type 2 diabetics. Um, and I know it's really fresh research. You may not have, interrogated the research findings, but the mighty avocado once again showing, especially in lab tests, that it's pretty good for us.
Mm. Time will tell. Very often these studies don't pan out to have clinical benefit, but certainly it's something that needs to be looked into, and further studies are required in humans.
All right. My studio guest tonight, Dr. Maligay Naiker, specialist physician and a diabetologist, will be taking some of your comments on our WhatsApp line. And that's the patients who are presenting as type 2 diabetics, the age
Much
is
earlier,
lowering.
much earlier. There are patients who are traditionally, we used to say that type 2 diabetes occurred after the age of 40. But now we are having children who are type 2 diabetic and as young as 6 and 8 years old.
Wow.
So it means that the risk is becoming far greater, especially if both your parents are diabetic. Your chance of becoming a diabetic is 50%.